Health Chat is sponsored by Buell Regional Health Foundation.
So Children's Dental Health Month, you can't help but think about all your little ones at home. It's a trigger issue for me because we have a now 6-month-old little guy named Peter. And now I feel the emotional connection that comes along with parenting and focusing on your children's health. But especially with teeth, being a dentist, I even find myself kind of like, freaking out. And it's as simple as getting those simple habits, those easy things, not leaving juice, not leaving milk, not leaving anything in their mouth. Poor dental hygiene for adults, children, and anybody in between. You're talking about bacteria that can get into the bloodstream from the oral cavity. Whether it comes in the form of an abscess or in the form of just a chronic periodontal disease kind of situation, you need to make sure you're staying on it early with simple fixes and simple habits that isn't going to lead to a traumatic, anxiety-filled association with the dentist and dental health. I think that the biggest thing that we like to do is not get the kids worked up, not make them think that being at the dentist is a negative thing, and we want to make it fun, obviously, and keep it pain-free. Infection in any form in the body, can take all of our body's resources when it comes to the immune system and focus it in that area. And sepsis is a possibility. Sepsis meaning a blood infection that could unfortunately lead to death, which sounds doom and gloom, but in the more realistic field and more common effects is tooth loss for children. You think, okay, they're baby teeth, we're going to lose them anyway, but the problem is spacing. If you lose a baby tooth too early, then that space is going to close. If that space closes, you're going to end up with a whole lot more complicated orthodontic situation and longer term with braces and even more potential for tooth loss in the future by removing teeth for orthodontics. So we like to make sure that we keep those baby teeth as long as they're supposed to be in there. It's never too early to get a little toothbrush in there. Even just a dab of children's toothpaste with fluoride, get that in there, get them used to having it around, make it fun, laugh. Rinse with water after you eat or drink anything that isn't water. That is the simplest, the easiest thing you can do to clear your mouth of the food particles, of the bacteria, and the acid that comes along with most foods. Without carbohydrates, without the acid, without the bacteria, it's impossible for cavities to form. So just a simple rinse and swallow of water will not only keep you hydrated, but it'll keep those teeth free from those harmful things. The guideline for most dentists is 2 years old. We want to see your kids come in when they're 2 years old, or a little bit after. Even if we don't do anything, it's just as simple as take a walk around the office, sit in the chair, up and down, let me see, take a look. Even if we don't get a cleaning involved, it's just about exposing them to the environment, making it feel normal, make it a positive experience, and have them coming back for the rest of their lives. Adults, children, doesn't matter who it is, we need to see you twice a year, every 6 months for a cleaning. It's just to make sure that if you do have a little problem, it doesn't turn into a big problem. So little problems, little costs, big problems, more expensive, and more time consuming, and there could be obviously a toothache involved. So fluoride comes from the moment teeth start developing, it's important. So before they even erupt into the mouth, our body is going to send the fluoride through our blood into the follicles that the teeth are forming, and it's going to make the enamel structure stronger. By the time they erupt, that's, so like that first part where it's ingested fluoride that's helping the developing tooth, that's when you're very young, important. You might hear about people with well water who need to supplement their children's water or give them tablets with fluoride. That's where that comes in. Now, once the tooth erupts, we want to bathe that tooth in fluoride in the form of toothpaste, in the form of rinse, to make sure that enamel structure is maintaining a strength that isn't going to break down as easily to decay. It actually changes the chemical makeup of the enamel structure from hydroxyapatite to hydroxyfluoroapatite, which is a much stronger, more resilient surface. Fluoride for children, super important, as early as when they're receiving their formula in a bottle, or if it's coming from mom. Mom needs to be having fluoride through her water, whether it's from the tap or from a fluoridated, purified water. There are fluoride tablets, there are fluoride drops, so talk to your dentist and they can get you those resources 100%. When it comes to children's dental health, just like any other aspect of their health, you want it to be something that's consistent and something you can keep up with and something they're going to carry on for the rest of their lives. So simple, easy habits from brushing in the morning, brushing at night, start playing with the floss once a day, and then rinsing with water after you eat or drink anything that isn't water is going to start that road to health. And go and see your dentist a couple times a year. Make sure that they're comfortable and they have fun there. And it doesn't need to be stressful or anxiety filled for anybody.